In the 50s, whites were dying more of lung cancer. By 65, it was even. By 1990, African Americans had surpassed them. So what happened? Forcing cigarettes down, and it isn't so much the menthol as a chemical, it's that it lets the poison go down easier and it affects much more.
Because menthol was the only flavor that was not prohibited at that time, and it's the flavor that African American black folks smoke, and so we have been fighting ever since then. So for those of you new to this, we have a lot of new people this year, and that's great. We're going to try to educate you, and for folks who are the old schoolers, we want you to help us to pull this flag.
Menthol and its impact on priority populations, not just African Americans, but other priority populations as well. It is a partner. It is a partnership that we have with the NCTOH to address this. So the partnership between us, the Truth Initiative, Campaign for Tobacco-Free Kids, we all have that same basic goal in mind. Eventually banning the sale of mentholated tobacco products. That is something that we absolutely feel as though we have to do if we're going to make a dent, in this whole tobacco epidemic. And so it's
that the tobacco industry targets specific vulnerable populations, what they call market segmentation to market their products to. We call it predatory marketing. I'm going to show you. They addict and kill those with the least resources and the ones that have the least ability to counter their assault. Bottom line, their consequences are deadly, and the fight back must take place on all levels. We did work with the FDA to do this work. We've worked at state levels, and now we're encouraging you at the local level to do this, because local areas can restrict the sale and distribution of menthol cigarette products. We're going to suggest to you that their local ordinances can be taken up, that as bad as the FDA has been on this, there still could be work done with the FDA as it relates to this. National organizations can pass resolutions. We're going to talk about 2 of them tonight with my colleagues. We're going to present some awards for that. We need hard-hitting media campaigns.
African American communities in a nutshell are very attractive to the industry because these are individuals living in situations that mean that they're a little bit vulnerable. So they have other social economic issues, they're dealing with a lot of stress, they're just kind of primed for an industry that has a lot of resources coming in to exploit them. And that's exactly what we've seen. For decades they did this. They would come in acting as friends, they would bring in their resources, and so it's very confusing when you get used to seeing a particular industry and their products in your community. And so part of what we've been doing is trying to re-educate our community to let them know that these are not necessarily our friends and to provide some evidence as to why we feel that way. We have evidence. I'm one of the original tobacco documents researchers from UC San Francisco, University of California, San Francisco, not in California. And along with some of my colleagues, including Ruth Malone, who's here and has been a partner of mine for a very, very long time, we were looking at these documents in terms of the tobacco industry's targeting of African American communities. Nobody had really done that. We had all kinds of evidence. We had the industry's own words that show how specifically important African Americans were to them. And what we found out is that it's like a cookie cutter approach. What they did in the African American community, they tried to do another marginalized group. So there were others who used the documents to show how the industry was also targeting their particular communities. And we know that, just the mere fact that they were in our communities promoting their products, that the tobacco-related health disparities that we see today are very much connected to these industry tactics. To share with you, this is a 1984 Philip Morris document, and this document helps us to understand why the industry is forming relationships with certain groups. And this document talks about it's like a savings account. One has to keep on making deposits into the savings accounts. Goodwill deposits of listening to their problems, bringing them along about what our problems are and how our problems, impinge upon their livelihood. And you make those deposits in the savings account so that when you have to make a withdrawal, the bank balance is theirs. So when we have these leaders, whether they're African American, Latino, white, or whomever, who's taking money, and they say things like, they don't control me, I make my own decisions. The evidence shows that they don't get to make that decision because the industry will come back at them. And it might not be evident to them, but they will come back because they give nothing for free.
It says the AATCLC presents the Karen Bass Visionary Leader in Tobacco Control Award to Delta Sigma Theta Sorority Incorporated for their vision, national leadership, and dedication to tobacco control and prevention. Thank you for helping to save Black lives.
Thank you. I thank you so much, and I humbly accept this award on behalf of our illustrious and visionary president, Dr. Paulette T. Walker, and the membership of Delta Sigma Theta, yes, 250,000 strong. I will say to you, and my message to you tonight is that, yes, we are proud that we were the first African-American organization to step up and take on this cause. Gladly, we are not the last. Some have joined us. We are proud of our accomplishments, but I do commit to you tonight that Delta Sigma Theta stands our ground in partnering with your foundation in saving the lives of our young Black youth. And I thank you so much.
In 2009, when we had our centennial, the NAACP had our centennial, and I became involved with the NAACP when we were working on passing a tobacco tax in California, and our state conference came out against the tax, saying that it was hurt Black people and was regressive. Dr. Valerie Yerg and I did some, brought the truth and did some presentations, and I went to the Berkeley branch and presented, and they supported us and went against the state, wrote a letter to National agreed with us at that time. But I promised them, because I was the youngest thing in the room and I wasn't a spring chicken then, that I would come back, that I would just use them for what I needed, that I would come back. I eventually became the president of that branch. I engaged respectfully with the NAACP, which is the oldest civil rights organization in this country. I gained respect. I was a revolutionary in college, and revolutionaries just tear things down, they don't build things. And so I had to respect the time and the energy and the lives that were lost with the NAACP, with their mission, the benefits that our people and all the colored people in this country have benefited from the fights that the NAACP engaged in. So we were so happy to get our resolution through California, through Berkeley, through California, and then this summer it passed in our national conference, and it's huge. We love the Deltas because they led the way, and all over the country we were singing that what the Deltas had done, and when you say that, people pay attention. They want to know what's going on, and so we know now that the NAACP is involved, and they passed a resolution authorizing all of the local branches all over this country to get involved locally in this issue because this is a local fight. So my heart is full to be able to give the award, our second award tonight, to the NAACP. And
Tonight we are excited to be able to present this award to a representative from the NAACP, Yanis Beck, who is a legislative, Banks, who is a legislative director with the NAACP.
Thank you on behalf of President Brooks, our national board, and our members. We definitely thank you for this. Because we do believe that our health is very important. Now, there's a lot of initiatives we've been working on national level as well as state and many states to get African Americans out to get healthier. And I think part of that is getting rid of these cigarettes. We've seen the data that they presented on how it can impact your lung cancer and how it impacts the children. And I know here in Austin, when I don't know if you've been able to get out, as Mr. Prince was talking about, you'll notice a lot of the restaurants and places are smoke-free. And when they was working on that ordinance, our state president here, Gary Gillespie, it was something he got out and supported. I think, matter of fact, he had to write a letter in support of that. And so we understand that here in Texas, how important that is. You'll see other cities besides Austin have that same similar ban. I think San Antonio is one of them right down the street. So we understand how important it is to get our people off these cancer sticks. and get them to have a healthier life so we can live longer and be more productive, be a part of the fight. Because criminal justice is real, the reform is real, and we need to make sure that we are involved in that.
It's a 1984 Philip Morris document, and this document helps us to understand why the industry is forming relationships with certain groups. And this document talks about it's like a savings account. One has to keep on making deposits into the savings accounts. You know, goodwill deposits, deposits of listening to their problems, you know, bringing them along about what our problems are and how our problems, you know, impinge upon their livelihood. And you make those deposits in the savings account so that when you have to make a withdrawal, the bank balance is theirs. So when we have these leaders, whether they're African American, Latino, white, or whomever, who's taking money, and they say things like, they don't control me, I make my own decisions. The evidence shows that they don't get to make that decision because the